Nation, Guru Nation, Guru Nation, Guru Nation. Guru Nation, I'm so excited for this. This is not one of those fake reaction. I haven't seen this. We got Daniel Rodriguez. By the way, put yourself in the camera, man. This guy and his team worked tirelessly. All right. Yeah, he worked tirelessly to make this event possible. This vlog, I'm going to react to it for the first time. My investigator here from Yuma Clinical Trials, Dr. Joe. By the way, we have a YouTube channel together. Underneath this video, go subscribe. We just talked about obesity and all kinds of stuff. Like, you got to go subscribe to Dr. Joe's channel right now. He couldn't make it to SOS. And I think you would have had a pretty good time, man. You would have networked with some people. You would have met some like-minded folks. You would have got good discussions with other investigators. They were there talking about ethical consideration for patients. When is it the FDA's responsibility? When is it the investigator's responsibility to keep patients safe and all that? You would have had a good time. This is the next best thing is the vlog. I don't know. I'm like very excited about clicking play here. And I guess I'll just pause when there's like a memorable thing if I remember what happened. But let's just see. Guru Nation, Dr. Joe, me, we're seeing this for the first time. Let's see what these guys did. This video team did, all right? Daniel Rodriguez, photo and video. Oh, let's go back. Let's go back. Pause. Go back. Now it's unconnected, right? Yeah. Okay. Let's just crank it. Yeah, here we go.
This is SOS.
Remember this place?
Look, I promise.
Remember this place? Tucson, man.
My stomping grounds.
This is going to be a long-ass reaction. We're only 2 seconds in. We're already pausing it.
Oh, so many memories.
Right?
Yeah.
So we did it right in the
Beautiful
Old
campus.
Main on the 3rd floor. You'll see.
Old Main?
Yeah.
Really?
Oh, no, not Old Main. Student Union.
Oh,
Sorry.
Student
3rd
Union.
floor.
Yeah, yeah, the big building. Yeah.
Mhm.
This blue skies, you're gonna just
The Sandia
follow me around
room
all
or-
day.
Yeah. We did the main ballroom, and then we had all the rooms around it.
Oh, wow. Yeah, that's a big building. That's a beautiful building.
We had about 400 people show up. Next year, the goal is to double it.
A girl I knew is on one of the banners in there. A girl who went to my dorm.
Oh, let's see if we see her then.
Yeah, yeah.
Okay.
This is SOS conference. Look, I promise blue skies. You're gonna just follow me around all day. You're gonna see the conference, the panels. You're gonna see the post party. This is more than just one conference. Like this SOS thing is a movement. We plan on doing not just a yearly conference. Thank you very much for following me. Hope you enjoy, and I hope this motivates you to come to the next one.
So that dude is Mitchell Hilby. He's a CRA. He's Batman. He's the clinical research Batman. He created the Clinical Research Justice League. You would have loved this guy.
Wow.
Yeah, he's amazing.
Dude, he's
We did a whole podcast on it. See, Batman.
Batman. We gotta get the mask later, but don't mess up your hair right now.
I knew I had to bring it. Oh, you have the Batman shirt? I didn't even notice that. Dude, yeah, the badge gets in the way.
I didn't
See?
even notice that.
That's pretty cool.
The badge does get in the way.
Let's get a photo of you two together.
It's already breakfast? Shoot.
You grab the mask.
Oh, yeah, dude.
It's in the backpack.
Okay.
Oh,
Okay.
yeah.
I just did an interview with the Batman, Mitchell Hilby, Clinical Research Justice League himself. I've already met a bunch of site directors just this morning, and I just got here. We're gonna go get breakfast right now.
Hey,
Dr. Fox
how's it
was
going,
on.
guys?
You're like the main dude behind the scenes. You're responsible for the 16. How many sponsors? 16?
Got 16 sponsors.
16
Yep.
sponsors. If this was just me doing this, we might have had 3 and that's it.
That's true. That is like a full-time job to get all those spots. So we ended up getting 16 sponsors. I don't know how much
amazing.
they paid. I was that far removed. They paid a lot of money, each one, to be there. They all of them said they're coming back next year. They even said they're willing to pay more.
Oh my gosh.
Yeah.
So I'm curious, how did the Batman guy get his name? Did people give him that name?
People gave him that name.
That's okay.
Yeah,
that's
he
pretty
did not
cool.
give it to himself. I asked him that in the podcast. He was like, "No, I'm not."
And they told him he has to wear the Batman shirt.
Yeah, like every conference he goes, he's known as Batman. In his LinkedIn, he has Batman as. That's a cool moniker to be given.
I think that's one of the highest honors. I'm a huge Batman fan myself, and
Okay, I got to show you his podcast.
yeah,
Definitely a full-time job.
Dude, thank you so much for doing that. Like, and I was telling people this is more than just a yearly conference. This is a movement. This is a platform.
It is. So we are all about being online, right? That's how we all
Yes.
came. So we all come together to kind of know that we're human and we talk to each other. But the conversation doesn't stop here. You go back online, you talk about it more, and you do stuff.
It just continues.
Just keep going.
Thank you, Dr. Fox. We're going to see more of this guy because he's going to be all over the place.
Oh, I feel the music drop. Oh, look at that. Got a little Snoop Dogg effect. Pharrell. Does Judy.
This is Brad, guys. You know Brad Hightower from Hightower Clinical. We did a podcast yesterday.
This dude partner with he started as a phlebotomist. So imagine Stephanie at the office. Became a coordinator. So imagine Katie. To where he saw the business and thought, I can do it better. Partnered with doctors around Oklahoma City. Is making multiple high seven figures a year running his sites from a phlebotomist. There's no ceiling out there, folks. If you work hard enough, like Brad is an inspiration to us all, myself included. He runs a really good clinical research network out there in OKC. And he's one of our SOS founders. You would have loved Brad.
The panel, he's a judge. Right?
I am a judge. In full judge regalia.
Full on, so you guys got to check that one out. Brad's going to be also in panel 1, walking amongst the crowd, helping foster conversation. So stay on the lookout for this dude, and if you don't follow him already, make sure you do so.
Music drop.
Okay, One in Health saved one of my studies a year ago. This is a true story.
I remember.
We screen failed. All we did, this was 2023, from January until May. We had like 3 studies. It wasn't just that one. You guys helped us with 1 study. We had the worst luck. I'm kidding you not, January to May of 23.
In your office.
We randomized 0 people across 3
Depressed as
studies
hell.
with 3 coordinators and myself and a nurse practitioner.
That's a lot of L's.
The first W came with you guys.
Love it.
I was ready to give up on that study. They're like, hey, you've been assigned randomly to this One in Health. I was like, cool.
They sent us leads.
Where you were like, oh, another
Saved us.
recruiter.
that's amazing.
He's good.
I even told them, man, these things suck, but just do it. Just do it because they want to see us they being the sponsor.
Yeah, sure.
Well, they started like calling and responding and screening and randomizing.
Yeah.
I was like, all right, maybe we got lucky. Let's do another one. Boom, we had 4 in a row. And then they ended enrollment for a very difficult study. We made 6 figures off of that.
I'm so happy for you. That's
Yeah.
what it takes is, you get people excited about it because it works, and then it's a flywheel.
And that's why you guys, I was like, we have to have One in Health as a SOS.
I can't believe I was doing all this shit with a backpack on. I should have taken it off. Like, maybe that's why I got extra tired that day, too. I was like walking around doing this with that is a full backpack, too. There's it's not empty.
So books,
It's
computer.
like travel already. Like, let's go. When we were in the office you're sitting in today, from January till May of 23, dude, we were making like nothing. We had 0 people qualified for studies. We were just screening. Everyone's failing. We're giving up.
They're too sick or they're too healthy.
Yeah. This study was so picky. They wanted everything. This sponsor just randomly, because all the sites are dealing with the same thing, they picked multiple vendors. So One in Health was the one we were assigned to. They were doing a clinical trial on the vendors. Like, let's like stratify these 3 and see which one, does best. We got lucky and got the good one. And we got 4 patients in a row. Those patients, completed patients, like 45 grand, 50 grand, 4 in a row from these guys.
Wow.
From Yuma. These are humans, but not up to par patients. And so they saved our study because that from May till October, we got those 4 in. It gave us more revenue. Then we got the weight loss studies that we just kind of talked about a little bit on your podcast and never looked back since. But these guys really helped us, and they sponsored the podcast at one point too. So I love One N Health. They're really cool. I wish I could have been an advisor. By the way, it's not too late, maybe.
Sponsor. I don't know if they want to do it, but we need them for Central recruiters. I think you guys are the only ones.
So we're the only ones that like want to actually have relationships with sites.
Yeah.
You guys, recruitment's a team sport. Doesn't matter how good we are at our job. Sites can actually do the thing.
So thank you for the work. We got to do like a podcast
Love to.
later on today. When you see me just standing around, just come find me. This is our setup right here.
Okay, cool.
Is you and Steve?
Yes, Steve.
Dude, have him come. You guys both come.
Awesome.
Student union.
I remember that.
It's paused.
I've been right there.
Yeah, multiple times. It's doing that the pause, but it's running through. Oh, here we go.
It's buffering.
From 4:55 to 5:03.
Okay.
Good turnout too.
We're gonna go in their first panel of the day. It's important to get the crowd pumped up. So we got a couple things we're gonna do to get audience engagement going, and it's gonna be like a tribute to the coordinator. So check it out. Judy's gonna win.
Judy's she's a site owner in Imperial Valley, California. So she actually comes here a lot. She's pretty cool. She works mainly with psych studies. There's Katie. You see Katie? So I just gotta say, this was my first panel 1, first one of the day. You know, internally, we're going back and forth, not me, on how this was gonna be handled. I must say we crushed it, right? And it was my idea. The way we did it, it was chaotic. I knew it would be, but it got the audience going, it got engagement going, and people really liked panel 1.
There was spontaneity mixed with the order.
Yes, exactly.
That's why it worked.
That's why it worked. So, yeah, don't like to pat myself on the back, but like internally, this was a fight. And
I just did.
yeah, there we go. Let's go. Nick
Good.
Foshiel.
We got the crowd going. Like, that was really the purpose of this. Not only to let the panelists shine, and we got a tie, which is like the perfect outcome. If I could have scripted it, it would have come out that way too. But the audience was engaged. They were way more engaged than I expected. Towards the end, we were running out of time, but then it finished like right on time. So it was really good. Panel 6 next for me. Katie, everybody, Team A, Team B, everyone did a really good job. Thank you guys so much. Guys, I'm still a businessman. I got to be strategic. So I'm here for SOS, but Yuma Clinical Trials, that's my baby too. So this, we just wrapped up the panel. I thought it was great. Brian, you thought it was good, man? I thought it was great. Man, it's done. We got the breakout session coming. I'm going to make this a Yuma Clinical Trials. The entire team is going to be in this room doing the breakouts. So we're going to go tell them right now. They all got to be here. Oh, they're right there. They're right there. I see them. Here they are. Here's the team. What's up, guys? We got breakout room. Hey, Jaime, you want to come to the Tucson room for the breakout thing? I'm going to make it like a YCT. See if Dora's there too. Tell her to come.
See, I didn't tell anyone we're doing that. Just like, everyone get in here. Let's do Yuma Clinical Trial thing. Lana Gracia Luis.
These are like the products of like recent panel one activities. They all now help. So you guys, so this is Lana, this is Gracia, this is Luis. We have Katie, who you saw on the panel. They recently told us, because I did the first interview, we thought there was a good candidate. It was Luis and someone else. And we were about to hire both, even though we really only needed one, because they both interviewed really well. Well, I had Lana and Gracia do the second round of interviews on both, and they kind of provided really good feedback that we would have missed. Lana and Gracia Luis did a great job on this one. You guys did amazing. That was good. Should do more panels. They look good.
There's Jaime up there.
There'll be like 5 people in here. A lot of people.
There's Dr. Al. This is a hematologist oncologist from Beverly Hills. Amazing guy. He's actually one of our co-founders. These are Ethan and
917 they came back.
those were Select IQ. Those are the people. I'm actually an advisor of their startup. Their AI is in Up to Par's medical records now.
Oh, yeah.
Works.
I remember hearing about that.
So we're training our protocols to find patients through their LLM, learn language models. It's pretty cool. We'll see if we actually find patients from it, but it's pretty cool. They're cool guys too.
Early though, and now we're going. I mean, if you pan around, you'll see it's crazy. Now we're gonna go do a podcast. In the tent? Yes. All right. Yeah. It matches with the shirt, man. You'll see when you get in there. All right.
Fort Kindness. No assholes allowed. Be nice or get the fuck out. People made this. The community made this. I laughed at it at first, right? It looks kind of weird. It looks like a homeless encampment in the conference, but it was like a safe space, man. Like if you want to get away from people and just go in there and you would hate it because it's candies and stuff, but like it's meant to be a safe space.
Yeah.
Dopamine hits, like, but you go in there, you look like you're on the other side of like AI, and like on the other side of the matrix. It's just really nice. It feels like a safe place to be. And I did 2 podcasts in there, so it's pretty cool. Shout out to the people that did Fort Kindness.
Stage B, look, no. Are you guys sure you can do? Meet these requirements.
I can definitely be nice.
The interview was amazing. The No Assholes Allowed Fort Kindness was awesome. One in hell. Awesome. We're going to be doing another one with MedVector, but right now we're going to go catch some panels because I didn't catch any. So let's go see some panels. So we just interviewed Scott from MedVector. Amazing. Dr. Fox is a huge fan of his. And now we're doing some panel prep with the next panel on industry relations. So we got this wants and needs board that people have been putting, and they don't know, but I'm gonna grab some and like read some on the panel and see what we can do. But hopefully, like, if nobody can help here, at least on the videos later on, it'll live on forever online, and we'll go live as well. So let's go grab the stickies real quick and then run back. Leave enough time for comments, live stream comments, and then wants and needs board, which I got like, here, let me give like 2 to each. I know we were supposed to. Right now we're at live. We're gonna incorporate elements of.
We're in the green room right here, about to get on stage. So I went live stream. Next year's conference, hopefully the whole thing is we can do virtual so that people don't have to travel. But I wanted to bring a little bit of that to this one. The acoustics in the room weren't that great for a live stream, but it was an attempt.
Being virtual next year, hopefully.
There's Monica. Shout out to Monica.
Videographer Brian. Hey, everybody say hi. Tiffany Fox. Dan, David. Monica. Adios. This is actually a good turnout. Let's go, guys. Thank you, guys. Last panel of the day before the after party.
They wanted to do a toast.
That's a wrap, guys. That's a wrap. SOS, day 1 of 1, done. See you in 2025. Bye-bye.
It was the after party.
The party is amazing. This is where the networking happens, meeting people, shaking hands, getting to know people. You can't replicate that. So there's elements of virtual, but there's elements of like in person. But you can't be wasting your time with a lot of these conferences. That's why we created.
Where was that?
I'm 3 old fashions deep right here, but this was Gentle Benz.
Gentle Benz.
Yeah.
Oh man, Gentle Benz, classic.
Remember? That's the reason why I'm not a doctor, actually. That's a big part of why I'm not a doctor.
Because of Gentle Benz. Oh,
Yeah. You didn't fall to those temptations.
oh, you should have seen my medical school.
Man, you made it through.
Yeah.
Gentle Benz had me in the traps.
Next year we'll do it again.
Nice. Very nice.
That's a good 13 minutes.
Well done.
Well, yeah, well done.
Like that captures so many highlights. But you probably got hours of footage.
Oh,
right?
dude, we have hours. Like he was saying, it's 23 minutes, the original one they had. So, but for a reaction, I think this was a good length to just give you an idea of what was going on. Obviously, it doesn't replicate being there in person, and next year's not gonna be in Arizona, so you're gonna have to travel if you want to.
Oh, where's that one?
We're debating it internally. Leave it at that. Could be Oklahoma City. Could be Las Vegas. It could be none of those places. Long story. But you should try to come. Dr. Joe, everybody, he's busy in the clinic. That's why he couldn't come. Go follow his channel. I know the food choices here you wouldn't like, but that bagel I had to
Oh no.
I loved everything about this conference, but the breakfast was just not good. Okay. There was no proteins. So I had to fill up my plate with some fruits, but it was carbs. It was muffins, which I didn't have.
Dude.
I didn't have.
Bad. Yeah.
So Lana went to go get some food. I said, hey, bring me back something with protein. She brought me back a sausage, egg, and cheese bagel. Shout out to Lana. And that's it. Follow Dr. Joe for better health alternatives and outcomes. Underneath this video is a link to his YouTube channel where I am often featured as a co-host, but when he goes solo, he goes cooking. He's really trying to make it actionable for you guys and gals to get your health outcomes in order and not just be a passive bystander and allowing others to dictate your outcomes. I think that's a fair summary.
Yeah, I think it's pretty reasonable.
Investigator as well. So thank you guys. Thank you, Dr. Joe, for putting up with this. Thank you, Daniel and team. Like, subscribe, comment, share. Bye-bye. Hey, if you guys like that kind of content, make sure you like, subscribe, comment, share. Stay tuned for more videos.